doing today?
I'm okay. How are you?
Good. Let me close the curtains, give you a little bit of privacy.
Okay.
My name's Elisa, and I'm a student at William Jewell College. I'll be taking care of you today.
Okay.
Before we get started, can I go ahead and get a name and date of birth for you?
Yes, I'm Mrs. Spezio, and my date of birth is 12/5/51.
All right, and Mrs. Spezio is okay? I can call you that?
Oh, that's great. Yes.
All right. And what brings you in today?
Well, I was doing a little bit of gardening, and you know how hot it's been outside.
Oh, yes.
I don't think I was drinking enough water, and I guess I passed out.
Well, I did see on your charts that the doctor wants to make sure we get you hydrated, and we're going to start an IV on you today. Have you ever had a IV before?
I have.
You have. Is there a preference on which arm to do it on?
I like this arm right
The
here.
left?
Mm-hmm.
Perfect. Let me go ahead and get my hands washed for you.
Okay.
Get some gloves on so we can get started today.
Okay.
So you have had an IV done before?
I have.
Okay. And also, Ms. Spezio, any allergies that I should be aware of?
None that I'm aware of, hun.
Okay, good. Now to get started, I always like to take a tourniquet just to make sure that we have a good vein to work on.
Okay.
Still doing all right?
I am, thank
I
you.
know this is always a little uncomfortable. It looks like you have some good veins on this arm. That's perfect.
Okay.
All right, let's take that off so we can prep everything.
Okay.
I'm going to go ahead and take my alcohol swab and clean you down for about 30 seconds. We want to make sure there's no germs or anything that can get infected on there.
Okay.
All right, and I do like to let that dry naturally, so I'll go ahead and prep everything else for you.
All right.
We have some saline because we like to flush that. There's always an air bubble, so I want to make sure that that is out of there. Great. We want to keep everything as sterile as possible, so we work a little diligently on that.
Okay.
Right, make sure that it does flush the tubing as well.
Okay.
Okay, that tends to spray a little bit, so we're careful. Again, I want to put that in that sterile packaging.
Okay.
Okay, make sure before I get that needle going. Just about ready,
Okay.
and I'll go ahead and let you know before
Okay.
I
appreciate
stick you so you can be ready for that.
that. Okay.
Not doing all right?
Yeah. Thanks.
And I always check that the needle is separate from the catheter. All right, so we're just about to start.
Okay.
On the count of 3, I do go in at a 10 to 15 degree angle.
Okay.
All right, 1, 2, 3.
Ooh.
All right, almost done. Doing all right?
Yes. Thank you.
Oh, great. And that needle goes into the sharps bucket.
Okay.
Let me make sure it's secure. All right, let me go ahead and make sure we don't get that on anything, but get the saline solution. I want to make sure that that is secure. And I run some saline just to make sure that the IV is in the vein. There's no infiltration. All right, great.
Am I good?
Everything looks good.
Okay.
All right. I'm going to take some Tegaderm. That's what we use to secure everything in place.
Okay. It's like a big Band-Aid.
It is. All right, let me make sure I get this off for you.
Okay.
Sometimes it tends to be a little sticky. I apologize about that.
That's okay.
And peel this off. All right, and we do have a little label here that I'm going to put my initials, date, and the gauge of the needle. We used a 22 today, so that's a small needle.
Oh, it's small. It's
I'm
a
sure
big
it didn't
number.
feel very small, did it?
No, but you did a good job, honey.
All right, I'm glad it didn't hurt too much for you.
Not bad.
That's all labeled, and that way the nurses and doctors know when this was put into place.
Okay.
All right, and then we like to take some extra tape just to make sure it is secure for you. Let's get that first one off. And we're almost done.
Okay.
And we don't want the rest of the IV kind of in the way, so I like to tape that down as well.
Okay.
I'm sorry about that. You know, tape can be a little stubborn sometimes.
Especially with those gloves on.
I know, but for your protection, for mine, here we go. Let me go ahead and clamp this off as well, just to make sure nothing's going through there. All right, I'm gonna get everything cleaned up, and I'm gonna check in about 30 minutes to make sure that the IV is looking good. Any other questions or anything else?
No, thank you.
All right,
Lisa.
have a great day.
You too.